Studies reveal that traumatic experiences during childhood, such as abuse or neglect, greatly increase the risk of substance abuse later in life. Teenagers who have suffered abuse are 3 times more likely to report substance abuse, and 70% of teens receiving substance abuse treatment have a history of trauma. Childhood trauma encompasses various forms of emotional and physical harm, including neglect, physical and sexual abuse, exposure to domestic violence, and family dysfunction. These experiences can disrupt normal development, leading to mental health issues like anxiety, depression, and PTSD, which are closely linked to addiction. The connection between childhood trauma and addiction involves several factors. Mental health disorders. Trauma heightens the risk of developing mental health issues, which often co-occur with substance use. Individuals may turn to substances as self-medication for untreated mental health conditions. Coping mechanisms. Traumatic experiences can overwhelm a child's ability to handle stress and emotions healthily, leading them to substances for relief. Brain development. Trauma can impact brain areas responsible for stress regulation, emotional processing, and impulse control, making individuals more prone to addictive behaviors. Escaping painful memories. Substance use can be a means to suppress traumatic memories, providing temporary emotional relief. Social and environmental influences. The context in which trauma occurs, like exposure to substance abuse or stressful environments, can amplify addiction risks. There are several therapeutic approaches to address these underlying issues. Cognitive processing therapy, or CPT. This helps challenge and modify distorted thoughts about trauma. Eye movement desensitization and reprocessing, or EMDR. This aids in processing traumatic memories through bilateral stimulation. Narrative exposure therapy, or NET. This involves retelling life stories to integrate traumatic experiences into a coherent narrative. Play therapy. This utilizes play to help children express and process their experiences. Comprehensive treatment for co-occurring disorders. This addresses both mental health and substance use issues simultaneously. Understanding the link between childhood trauma and adult addiction is crucial for effective prevention and treatment strategies. By addressing these deep-rooted issues, we can foster resilience and recovery in those affected by early traumatic experiences. For helpful information on your journey to recovery, visit strugglingwithaddiction.com.